A new health alert tonight again surrounding common painkillers like Advil, Aleve, and Motrin. A new study now warning that mixing those with antidepressants could increase your risk of intracranial bleeding.
Chief Health Editor Dr. Nandi joins us now. And Dr. Nandi, just last week you told us about heart attack and stroke with NSAIDs. Now this.
Yeah, it just keeps coming up. I mean, I'm passionate about this because so many of my patients take it. You know, it certainly should make you think twice about popping ibuprofen for every ache and pain. This new study published in the British Medical Journal is making waves today. Now, researchers looked at the records of more than 4.1 million patients on antidepressants. And here's the big news and the findings that people taking antidepressants and NSAIDs were almost 4 times as likely to suffer an intracranial hemorrhage or a bleed in the brain. That's one of the main causes of a stroke and can be fatal. Now, men were found to be more at risk. Now, the researchers emphasized that the findings don't necessarily mean that this drug combination causes the bleeding, but it's a possibility that needs to be explored further. And that's a big problem. Conditions requiring NSAIDs and antidepressants commonly coexist. 65% of adults with major depression also have chronic pain. You know, so it's a big problem.
So what is it about the antidepressants that cause the bleeding?
Yeah, so it's a great question. So people say, what is the connection, right? Antidepressants and NSAIDs do something in common. They inhibit or stop something called platelets. Now, platelets help you do what? Clot things, right? And if you inhibit those or stop those, you can have increased risk for bleeding. But I want to put it in perspective. This is 4.1 million people that were studied. 742 people had the bleed, which means 99.96 people did not have this problem. So we got to keep in perspective. I don't want people to panic, but I just want people to say, listen, you know, every time I have an ache and pain, don't pop this medicine. Every time you feel sad, don't ask your doctor for an antidepressant. So it's important.
But if you are taking antidepressants, what should you do?
You know, I think if you're taking antidepressants, make sure that you can, first of all, minimize it. So, second of all, take Tylenol if you can. Minimize the dose of the NSAID. So if you're taking ibuprofen, take the lowest dose possible. Sometimes you can alternate a Tylenol with an NSAID. You can sometimes take also a narcotic pain medication. Ask your doctor if it's right for you. If you can work those, you can really do it safely. But I think that people can take this combination safely. Just ask your doctor.
And all roads leading back to Tylenol. You know, it's
exactly.
old school. It's been around for a while. It's the safest, you would say?
It is the safest, and it's not a panacea. It's not perfect. So you don't want to take too much Tylenol or you know, take it on an empty stomach.
There's liver issues with that.
That's
too,
exactly
though, right?
Especially if you're drinking. You know, even drinking moderately and not eating Tylenol can cause problems. So what I mean is that maybe alternate, take the minimal dose of Tylenol and NSAID, work it together to get the benefits of both without getting the risk. And this is what it is. You have to work with your doctor. I keep saying that. People just think, you know, oh, you know, here's an over-the-counter medicine, I'm just going to pop it. Talk to people that know.
They can be dangerous as well.
Thank
Absolutely.
you, doctor.
Oh, it's
Thank
my
you.
pleasure. Namaste.
Thank you.